Procedure for determining blood pressure. Explain to patient what is to be done.
Okay, I'm going to go ahead and take your blood pressure. Just standard procedure. Go ahead and stick your arm in right here.
Have patient relax in upright position with arms slightly flexed, with palm up and supported at chest level. Use either arm and take blood pressure on bare arm, not over clothing. Apply appropriate sized cuff with the portion of the cuff that contains the inflatable bladder directly over the brachial artery. Fasten cuff evenly and snugly with lower edge of the cuff 1 inch above the antecubital fossa. Adjust position of gauge for convenient reading. Palpate radial artery and estimate systolic blood pressure. Close airlock attached to bulb. Pump to inflate cuff until radial pulse stops. Note the reading at which the pulse disappears. Release all pressure in cuff.
122.
Position stethoscope end piece over palpated brachial artery 1 inch below the antecubital fossa and slightly toward the inner arm. Inflate cuff to 20 to 30 pounds per mercury beyond the radial pulse was no longer detected. Release airlock slowly. Listen for first sound, systole. Note the number on the dial. That number represents the systolic pressure. Continue to release pressure slowly. The sound will continue, first becoming louder, then diminishing and becoming muffled until disappearing. Note the number on the dial. The last distinct sound was heard. That number represents the diastolic pressure. Let the rest of the air out rapidly and record the readings to the nearest even digit.
122 over 78. And the average is 120 over 80. So you're within normal limits. Okay. You're good and healthy. Alright, thanks.
Wait 30 seconds between readings before retaking blood pressure.